Assalamu alaikum wa rahmatullahi wa barakatuhu. Rabbi shrah li sadri wa yassir li amri wahlul uqdatam min lisani yafqahu qawli. O my Lord, open my chest for me, make my task easy, and remove the knot from my tongue so that they may understand my words. Allahumma anfa'ni bima allamtani wa allimni ma yanfa'uni wa zidni ilma. O Allah, benefit me with what you have taught me. Teach me what will benefit me and increase me in knowledge. Ameen. Good evening and a very warm welcome to everyone joining us today for this much needed session, Stethoscopes and Silent Struggles for Future Doctors, organized by IMSA. This session aims to shed light on the often unspoken mental health challenges faced by future healthcare professionals like ourselves. Myself, Amatur Rahmaniram, final year MBBS student from Mallareddy Medical College, and I'll be serving as your anchor for today's session. It's a pleasure to be here with you all, and I sincerely hope this session finds everyone in good health and high spirits. Every noble gathering begins best with the words of our Creator. To seek His blessings and invite His mercy into this session, let us begin with the recitation of the Holy Quran, the eternal source of guidance, wisdom, and peace. I now call upon Abrarul Haq to enlighten our hearts and minds with a few verses from the glorious Quran.
السلام عليكم ورحمة الله وبركاته. أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. والضحى والليل إذا سجى ما ودعك ربك وما قلى وللآخرة خير لك من الأولى ولسوف يعطيك ربك فترضى ألم يجدك يتيما فآوى ووجدك ضالا فهدى ووجدك عائلا فأغنى فأما اليتيم فلا تقهر وأما السائل فلا تنهر وأما بنعمة ربك فحدث الله العظيم.
Subhanallah. May these words illuminate our hearts, guide our intentions, and bring peace to our gathering. Ameen. IMSA, the Initiative of Medicos for Service and Academics, a non-profit initiative taken by medicos from all over Telangana, aims to create a unified platform for medical students working towards self-improvement and upliftment of the society under the divine guidance of Islam. It also strives to build a purposeful space where budding healthcare professionals grow not only in academic excellence but also in character, community service, and spiritual development. This session on stethoscopes and silent struggles for future doctors has been thoughtfully curated with the aim of addressing one of the most pressing yet often overlooked aspects of medical life, that is mental health. As future doctors, we are trained to heal others, but very rarely are we taught how to take care of our own emotional well being. Tonight's session will focus on crucial themes such as mental health literacy for future doctors, that is, understanding how to recognize, address, and support mental well being in oneself and peers while navigating the medical journey. The neuroscience of emotions by exploring the science behind emotions and practical ways to manage them effectively. How to help a friend with mental health struggles by learning the right approach to support peers through emotional or mental health challenges. Panel question and answer, a safe, open platform to address unspoken questions and concerns about mental health. We are truly honored to have with us our esteemed guest speaker, Professor Farooq Khan, sir, who is a distinguished consultant psychiatrist based in Birmingham, UK, with expertise in dementia, depression, anxiety, bipolar disorder, and cognitive disorders. He completed his MBBS at Deccan College of Medical Sciences, followed by an MD in psychiatry from the Institute of Mental Health, Hyderabad. He later earned an MSc in medical education from Stafford University. Professor Farooq Khan sir is a fellow of the Royal College of Psychiatrists and the Indian Psychiatric Society. He serves as the clinical lead for dementia for NHS England and holds academic roles as a visiting professor at the University of Chester and senior clinical lecturer at Aston University. With over 2 decades of clinical and academic excellence, he is widely recognized for his leadership in mental health care and education. We feel truly privileged to welcome our eminent guest. It is now time to hear from the expert himself. Over to you, sir.
Thank you. Jazakumullahu khairan. Assalamu alaikum wa rahmatullahi wa barakatuh. I'm sure you're able to hear me. I'll just try and share the slides with all of you. Just someone put in the chat or just say whether you're able to see the
Yes, sir.
slides. And
Yes,
you can
sir.
hear me clearly as well.
Yes, sir, it's clear.
Yeah, great. Okay. Again, Jazakumullahu khairan for inviting me to talk to all of you. And really delighted to see that in the sort of late night of 9:15, there are people who are interested to listen and hear about psychiatry, mental health issues, and specific focus on the doctors. And I think I also again thank the IMSA organizers that you have thought about this very pertinent issue and also focusing on the doctors. In general, mental health is not in the focus many a times, but then you have not even brought it in focus, but also focused on the mental health issues of the doctors and medicos will be the next line future doctors who will be looking after and taking care of all the ailments and difficulties. But first of all, are they or are we looking after our health, our mental health or not? I think that is the focus of the discussion today. So it was really good to hear the recitation of the Quran as well, alhamdulillah, and the translation. People are really keen to know what is the Islamic perspective on this as well. What I will do is I'll focus on the main topic, which we will be discussing in detail. So that is the neuroscience of emotion and the emotional resilience. At the end of it, I'll just have a look and check whether you have got some understanding of this topic or not. And then towards the end, we will have the panel discussion in which we'll be able to ask the question and answers. And as far as I'm able to, I'll answer your questions. If I'm not able to, then please connect me from different means that you've got. Most easy one is the email address to contact me. It will be much easier to respond to you in that way. But I'll cover the neuroscience of emotions. I'll focus on the do's and don'ts for the helping a friend if somebody is struggling, someone who you know. And also the focus will also be mainly the emotional resilience and how to build the emotional resilience among all of us. And also one of the aspects again, which is seen as less important in the medical fraternity, but I think is one of the most important aspect of a doctor to make them a holistic, a comprehensive doctor, whether you're a physician, whether you're a neurologist, a cardiologist, a psychiatrist, a dermatologist, it doesn't matter. If you are good in listening and providing the care and compassion that all is needed many a times to treat an illness or a condition. And this becomes more important as we talk about the mental health issues among doctors. So this is a question I usually ask them in the face-to-face. So if had it been the face-to-face, it would have been really good. I was in the last week at the Deccan College of Medical Sciences. It was really good to interact with the year 1, 2, 3 medical students and also the faculty as well. It was really delighted to see a lot of people interested in the mental health topics. I do have the habit of giving chocolates out to people when they answer the questions, but I don't have any chocolates now because the Zoom session. At some point, if we have a face-to-face in the future, then we will have, I'll bring chocolates as well for the right answer. So how many of you would want to be a psychiatrist? So this is a question I think probably it is difficult for everyone to answer this, but maybe if a few of you either put up your hands just to say that yes, you are, or put it on the chat to say yes. Okay, so I've got one hand raised. 2, 3. Okay. Any more? Okay, so that's fine. So I think I've got about 3 hands up to say that you would like to be psychiatrist. That's really good. So you are about 40 on the call here today, about 50 now, just now on the call today. So for now, I think who are there in this WhatsApp, but maybe people are listening on the live stream as well. So it is really good to see there are about 3 out of 50 who would like to be psychiatrists. I'll just check somebody texted as well. Okay, yeah, no, that's fine. Yeah, we'll use the chat for responses, but I think there are about 3 people out of 50. That's a good ratio of psychiatrists. But then I think that is one of the problems as well. Had the question been a neurosurgeon or a CT surgeon or a cardiologist, I would have had at least double figure numbers raising the hands for this question. And then this leads to the second bit of the question. Why do you think is the case that a lot of us don't want to be psychiatrists? What might be the reason? So again, you can use the chat function on that to say, what do you think? So people just put in the chat, what's your idea that people don't want to choose psychiatry, or it is one of the less likable specialty within the medics itself. And that explains you in a minute when we talk about the reason why I'm focusing this session to start with. Okay, so the first response comes up as stigma of consulting a psychiatry or without any due awareness. So yes, that's true, and that's number one. Stigma stands out to be one of the first ones to be seen as a reason why people don't choose psychiatry, because it's seen as a different specialty. Emotional trauma. So I think people feel that it is quite difficult to be a psychiatrist, deal with a lot of difficulties as well. I think it becomes quite difficult for some people to take on psychiatry. Right. Okay. So yeah, there's another response as well that some people feel that psychiatrists need a psychiatrist. I don't know how much true that is, because I have up until now not been to a psychiatrist myself for treatment. But yeah, we'll touch on that as well. It's an interesting comment. Good. So yeah, so I think there are various reasons, and I think we'll touch on few of them. What is the reason that people do not choose psychiatry as a profession? And one of the reasons being the stigma, which stands out biggest of all the reasons why people don't choose psychiatry. Just look at the background of what's happening around us. So this is a common news in the media. This is not rocket science I'm bringing from some sort of statistical based research, but these are the headlines of the newspapers. 118 fatal suicides among MBBS students, postgraduates and working medical professionals were reported. I think this was between 2020 and 2022. And it's very recent data. More than 50% of the reported suicides were before the age of 30. So almost half of them committed suicide at a very early stage in their 20s, 30s. The most common method was hanging, 49%. The presence of mental illness was present in 12% and the commonest predictors of the suicide among medical students and professionals. And this is a very recent data, as I said to you, about 3-4 years back data, which backs up the fact that there is a gradual, steady rise in the number of suicides. Now, this was around the COVID time as well, which explains some of the reasons as well. Now, but this is not a standalone piece of work. So there was a recent survey that was conducted, and this was published in 2025 by the NMC. 28% of the undergraduates and 15% of postgraduate medical students have mental disorders. So if you look at the previous slide, I've just put it up for you. It was suggesting that 12% have mental illnesses, and that will be taken as a diagnosed mental illness rather than somebody who is known to have some mental health issues. No, it is 12% is somebody who has been treated and who was having this condition. So the NMC survey reports 28% of undergraduates, 15% of postgraduate medical students have got mental disorders. So that is somebody who is giving an anonymous survey on people, and somebody's asking that question, and then you are able to fill up the answers. So that ratio goes up quite high. That percentage is 28%. That is more than a quarter of medical students, undergraduate population has got mental disorders. And if you compare this to an email survey in a premium medical institute, so that was the NMC data, but in comparison with a one institute, there is a degree of 90% people having burnout of doctors. Depression is present in 30%, and suicidal ideation in 16% of the population. By any means, I think this is quite a startling report of 16% of medical students expressing suicidal ideas, which is quite high. Research has also shown that doctors are more vulnerable in their formative years. So as the time goes by, there is a development of resilience, and this is our topic to talk about. So, but I think it is quite important to know and focus that when you are in your formative years of first, second, third, fourth year, then your house internship, and then you've got your post-graduation years, and then your initial part of the career. These are the most vulnerable years, and then gradually people start to develop resilience. But then it's not just in the medical profession to say that only the doctors suffer from, but in the medical fraternity, you've got the nurses, the healthcare support workers, the other people who are in the admin group. About 50% of the nurses do not have any mental health support. So, I mean, you can imagine that at least you as a medic will have some support coming to you in when you need it. When you want someone to help you, you might be able to go to the doctors, but the support available for the nurses is quite negligible as well. This must be the medical education and an NMC guidelines should be there, that there is no health without mental health. And if you look into the definition of health, so I mean, a lot of people have studied the preventive medicine and study the preventive medicine in the right sense of it. The definition of health that includes the well-being, which is comprehensive, physical, emotional, psychological, social well-being. So that means that if you take only the medical well-being in the pure sense of the medical fraternity or specialties you're talking about, then you are limited with the idea and the concept of the well-being. But it has to be a comprehensive and holistic well-being that should include the mental health as one of the important areas of care and concern, and should be included in health. So it is a social well-being, you've got emotional, workplace. So all of you will be working somewhere in the hospitals, in the clinics, in different departments, either government sector, private sector, and there will be different kind of pressures there, and that'll impact on your well-being as well. And then you've got societal well-being. How is your society and community? Is there a support available? Very good to see the initiatives like the IMSA, who are trying to address these issues by talking to people, getting the professionals together to have these programs. And so that's why the overall concept of psychological well-being should encompass all well-being. So it should be included that the mental health can't be left apart or left differently. It has to be part of the well-being across the spectrum. The current situation of India, where in the news articles, I mean, you keep on reading about things, especially the physical violence and aggression that has increased in the recent years and months. I would say that there's been no more headline news. It has been the case many years back as well, I remember. But then the extent and with the velocity with which the physical aggression and violence has increased, that is quite fearful situation. People might be quite scared about the practices and the way they treat people, and the way they respond to the patients and the families, because there have been quite aggressive responses that have come about when people have been treated by the doctors. So that is one thing which stands out in the in a fear situation that is created. And then you've got the intimidation by gestures, so the use of power or the proxy powers, and intimidation is another tactic to instill fear in people. Then cyberbullying, people who are available on the social media or on different social media platforms can be bullied quite easily, which is amounting to harassment by different people. But also there is harassment and abuse by the authorities. Sometimes the senior administration management of the hospital or the political powers, and that sort of pressure is quite difficult to handle and deal with. There is blackmail, and there is also an unfortunate situation of mob lynching that instills some sort of fear. And this is the not something which is unique to one particular place, but it is across in India. You can feel that this is happening. Now, there are various challenges as doctors. So some of you might be budding doctors, some of you might be practicing for years, some of you might be sort of practicing now, but then not start to practice, but doing in the future as well. So there are crises that comes in. So the best example I give and quote to people is the COVID. So COVID was a testing time for everyone. Doctors were the front line, and you've seen how the doctors and the medical fraternity responded during that time. It was quite a stressful situation for all of us, but the doctors were in the front line to manage that. So these crisis situation will keep on coming. That puts a lot of pressure on doctors. The fear and phobia are from various aspects. One of the thing is just now mentioned about the intimidation and the scare tactics by different groups and individuals, and also the fear of unknown and uncertainty. And there is intolerance of uncertainty. I think that is something, what is going to happen in the future. Apprehension of things can also make the situation really difficult to manage, and it is one of the challenges. Anticipatory anxiety or anticipatory worry that something is going to happen in the future, and what's going to happen to my patient. You're a surgeon, you have operated, you're an anesthetist, you have done surgery, you're an obs-gynae consultant, and all these areas, and being a psychiatrist as well, you have a stressful situation as well, sometimes suicidal patients, and everything will be on the buck stops with the consultants. And this is the case in many countries, including in the UK. And perceived vulnerability. So sometimes it does happen that the situation is sitting outside, the stress is outside, it is not inside in your head, but then you create an atmosphere and you perceive it to be present inside, and then you build up the anxiety. And we'll talk about that when we talk about some other remedies, how the stress management can help people. There is a lot of emotional impact with all these things going on around with your careers, I think with your jobs, with your how you are seen by the public and people, and how you respond to their anxieties. This will have an impact on your mental health as well. There is a financial impact which can't be ignored, and sometimes this all leads to a situation of despair, where people feel left out and not know how to respond or how to behave in a particular situation. So coming to the emotional aspects, and looking at the area of the neuroscience of the anxiety or the emotions, how that is developed. So we do have the areas of the brain, which is taught in your 8th or 9th standard. I think by 12th standard, I think most of you would have studied this before even joining the medical school. The fight, flight, and fright response, the freeze response, which is mainly the amygdala, which is talking to you or behaving in that way, or making you behave in that particular way. The cerebral hemisphere, which is the mainly cerebral cortex, will receive the response to the threat. So that is the area which perceives the response from outside. And anxiety can be caused or kept alive by negative thinking or ruminations. So with previous experiences, the way you have reacted to that particular fear or a moment of stress or anxiety, your external response will come out in the form of the anxiety attack, the panic attacks, or a generalized anxiety. So examples of this include worrying about what might happen. So this is anticipatory anxiety. And then ruminating excessively. That is, you're thinking about the same thing number of times, despite the fact that your anxiety has been allayed by various means, you still feel that you're anxious, the worry is not gone away completely. And what is going to happen? in the future, and that will impact your current, and then you start to catastrophize, and that will throw you into a panic attack or a panic disorder if it continues for more than one, 3 occasions or so. Amygdala response, then again, this is the fright, flight, and freeze response. So this is something that happens the way you either you embrace a situation, you fight with the situation, and you come out of it, and then or you just flight, you run away from that situation, or you don't have any response, you just freeze. And this is one of the responses that you will do when you're faced with that situation. So this is basically what our emotions are presented, especially the anxiety. Now, how do you express our emotions? Now, there are very clear-cut emotions which are present in everyone, and then we have got this sadness, which is a clear emotion that we all experience, anger, and none of these expressions are abnormal or pathological. So these are sadness is present in many occasions. So if we lose our loved ones, if we lose someone very close to us, or missing an examination or deadline or stuff like that, it becomes sad. You become angry on the various situations, frustrations, despondency, anguish, disappointment, envy. So all these are normal, healthy emotions that comes across in people feeling hurt. And this is the way your internal emotional state in the mind is being expressed. So being sad or happy or frustrated or despondent, envy, hurt, all these are different types of emotions. And none of them are pathological. They will become pathological when it is quite sustained for a long time. So you've got sadness over a period of months when you've had a loss, and then months and months after, it may turn into a pathological grief. Then you might need support. You might enter into a phase of depression at that time. If you're constantly angry about something, it is possible that it's something to do with your limbic system, amygdala. There's a problem there. You need to address that. Getting frustrated, despondency, low mood, self-esteem, those type of things are all or may all lead to clear-cut depression or anxiety. So these emotions are healthy, normal, but then it becomes problematic when it is consistent and for a longer duration of time. Fear is one of the fundamental responses of the emotions, human emotion. Now, fear will cause you to do the fight, flight, or freeze response. So either you fight that fear, you run away from that, or you freeze. You don't do anything, but just you freeze in yourself. But then fear many a times robs you of your positivity. Now, it will give you the option of either flying away or not doing anything, but less of a fight. Now, you can imagine if the fear is that of a mosquito, and you might fight, and you might get a lot of repellents in front of you. But then if it is of a tiger or a lion in the room, then your response might be different. You might say, no, the flight is the best thing to do here. And that's right. There's nothing wrong in that. But then freeze response, when you are not able to do anything, and that can cause a number of issues or problems. Your anxiety states might get more and more increased. So you might either take a flight response or you might take a fight response if you're able to fight. Now, in doing that, for the fears, one of the things to do is, instead of looking at the negative aspects, you can look at the positive gains or achievements throughout your duration of time. So something happens in your career, a progression in your assessment, examination, a failure. One of the good things to do is look back and what things you have done good. Obviously, you have to focus on what has gone wrong and bad, but also don't become completely occupied or preoccupied with the failures in your life. Look at the positive gains you've got. Live fear and worry once, and then learn from that and move on. So do not be fearful of of what's happening to you. Do not be fearful of what's happening around. So be very confident that you'll be able to overcome. Mark Twain has said this: "I'm an old man and have known a great many troubles, but most of them have never happened. So many a times it is anticipatory anxiety, something going to happen in the future, something bad, something worse going to happen in the future. But those things actually do not happen, do not occur. Not to say that failures or the negative things don't happen, they do happen, but then most of the time we fear and don't act on things. So the other part to cover was to, so that bit was mainly around the neuroscience or the emotions that we have just gone through. How do you help, or what do you do to support someone who is going through the mental health difficulties? So I've just put down some of the do's and don'ts in that. So be non-judgmental to people. So I think one of the issues we do have, I think, as doctors, we just come to conclusion of something, try to talk to people about that and try to address that hands-on quickly and say that, oh, I've done this solution, I've solved the solution, because we are focused on sorting solution. But one of the things to keep in mind is you're talking about your friend or a family member or a relative, a neighbor, a community person very close to you. And in doing so, you should be aware that you shouldn't be becoming critical. So be non-judgmental on them. Use the care, compassion, and support. So whenever you can try and use the compassion, be compassionate, be supportive, and use that as something which is an important area to provide help and input to anybody. I mean, even your patients, you're treating them, but when you're talking about your friends and families, you need that compassion. And towards the end, I'll put a slide up for the mindfulness, which draws the importance on the aspect of the care and compassion, how you do that in a proper way, and I'll focus on that as well. Speak in confidence and no rumors. So another thing which I have seen is when we start to talk to people, it becomes a cafe discussion. So if you have heard something from somebody's suffering, one of the colleagues, your friends suffering this moment, and you start to speak and talk about that. Confidentiality is an important part of the medical profession. You shouldn't be breaking the confidentiality at all at any cost. So you shouldn't be interfering with the trust that the person has put in you. So this is also the amana from the Islamic point of view as well. It is untrustworthy of you to break the trust of someone who is disclosed in you. I mean, when it comes to something like a serious condition of suicidal ideas and thoughts, I mean, you might take the measures which are appropriate to disclose that information. But then it is something to do with the mental health condition of depression, anxiety, or any other form of condition. You should be very careful in disclosing that information generally to people and letting people know and talking about that thing among groups of people. You should avoid that. That is not a healthy sign you should be involved in. So speaking in confidence, because you lose the trust of the person if they come to know that we've spoken about the conditions in front of other people. Again, involve them in the activity. So as soon as you know about them, one of the things that doctors we do is try to cover that up and make the protective blanket around them to say, oh yeah, we should not be involving them. We're going on a day out, so we should exclude them. We are having a party somewhere, we need to exclude them. We are attending a function, an event, we shouldn't be inviting them. You need to include them, and they should not be seen as being complete outcast or not being involved in the day-to-day that was happening just a week or 2 weeks before, and now you're behaving slightly odd with them. Be a true friend in need. Now think about this. This is not scientific, or this is nothing to do with this sort of neuropathology or psychopathology of anything, but this is something which is very common. It's common sense. Your friend who is trusting you, disclosing some information, or willing to disclose information in front of you, is doing it on the basis of a true friend. That you might not be judgmental with them, you might not think otherwise of them, you might not be critical with them, and you might be trustworthy, and you are lending a listening ear to someone. And that is something which is important when you are listening to someone. So listening with care, and that is a part of the mindfulness I was mentioning earlier on. I'll go into a bit towards the end. You have to be respectful, because they have trusted on you, not in many other people. And then gradually over a period of time, when you are satisfied with that, you can encourage them to seek help, because sometimes in our doctor mode, as soon as you've known them or talked to them, you say that, oh, go to a psychiatrist, and that might come to them as a bit of a shock, as you've seen earlier on. Out of 50 of you, 3 of you said that you'll be psychiatrists. That it's not a bad um, uh, number at all, I think, from the current trends, but it's still, I think it is a bit of a stigma which is there, and you have to be careful on that. And also think that it is not just about that day or that week or month they have spoken to you about. It might be a long-term, long-drawn thing. So it might be something which will continue for a long period of time, that you have to be available for them, that you're not just coming and going away with them. So I think uh, if you follow these do's, that is something very, very helpful for your friends. You shouldn't be, so don't, you shouldn't be out making them outcast or isolate them. I said including them. I mean, most of the do's will be don'ts. The one you should not be doing them. So gossip, speculating, again, trustworthy. You are a trustworthy friend, so you should not be gossiping around with other people about them. And then again, it goes without saying. Don't come into that preaching mode or a teaching mode. Oh yeah, that happened to me as well. So yeah, give an example. They say, okay, last month I was also depressed and I was just having a cup of tea with my friends and everything went away. Someone is disclosing a very sensitive information to you and wants some help and some, maybe a support, maybe a listening ear. As I said to you, it might not be a treatment or a help of that kind, but just maybe trying to get some idea of what you can say to them, but don't come in that preaching mode quickly, or start to tell them about what to do. And don't be a critique of them, to say that, oh, because you have not done these exercises, because you don't do much of the mindfulness or breathing exercise, that's why it's happened. You've not taken any medication, that's why it's happened. Don't be a critique, because they're not there for you to be critiquing them. And then this attitude sometimes that comes up in some people about condescending or patronizing type of behavior, and that is mainly to say that someone is inferior to them, someone is sort of lower in their knowledge base, or something happened to them because psychologically they are vulnerable. That's why you advise them in a condescending manner, which is really bad. And I think examples of that can be many. So if they ask you something, say, oh yeah, it's very simple, why are you asking me? It's a very simple thing, go and seek a psychiatric help. I mean, that will be sort of appearing as a very sort of rude type of presentation. So don't be condescending to people who are trusting in you. And again, as I said to you early on, they are coming for the listening ear. Don't jump to the doctor mode immediately for solutions. Okay, go for the CBT, cognitive behavior therapy, take fluoxetine, and then you'll be better. So don't jump to that conclusion so quickly and so bluntly in front of them. Also, I think the victim blaming is something which is seen, unfortunately, in different cultures, including ours. I think that whenever people are in a difficult situation and they are trying to get some help, people start to say that you are responsible for this. You have done this, and that's why this has happened to you. You have failed the exam. You didn't prepare well. That's why you failed, and now you're feeling low and down and depressed because you didn't prepare well for the exam. So victim blaming is a common thing that happens very, very regularly, and doctors are not immune to that as well, and that should be avoided. The unfortunate thing about this is also expressed emotions. So some of you might know this, some of you might not know. Expressed emotions is something when there is a mental illness or a condition which is present in a family member. The all other family members will try and say things or do things in a manner that is very very damaging or very hurtful to somebody who suffers from mental illness or condition, and they do things in that way, and everybody talks about it. Say, oh, you've got depression, or what happened to you? How will be your career? You'll be going down. You'll be taking some antidepressant. You'll be sleeping all the time. So this becomes a negative sort of emotional reactions within the individual, and the whole unit and a system of the family will become quite a difficult one to manage. And that's why many times people become quite isolated. They don't want to talk to these things with the family members, and trying to trust you as a friend. So these are some of the tips, I think, which you can we can use it to help people, and do's and don'ts of this particular area. Now, coming to the emotional resilience, there are many definitions. You can have a look at that. So the GlaxoSmithKline company, they have put down resilience as the ability to succeed personally and professionally in the midst of a high pressured, fast moving, and continuously changing environment. So if you look at that, resilience is something not just as a doctor, as a professional, but it is a personal thing that is developed, or that some people possess, or some people develop it, which is personal and also professional. And it is not just a routine stuff that goes on in your life, day to day, morning to evening, a call in the hospital, or the evening clinical practice, but it is more of a high pressured, changing, fast moving environment. In that time, and in that changing atmosphere, changing environment, you continuously try to develop and succeed personally and professionally. Now just think about this. Think about this for a second, or a few seconds. The resilience is a pretty hard thing if you look at it. So it is suggesting that personally and professionally, you should be succeeding and doing really, really well in a high pressure, fast moving environment, which is ever changing. It is not stopping to change. And we all like stability. We all like to be present in a very stable, quiet, calm environment. But then a fast, high pressure environment, fast moving environment, you have to be successful in that. But that's what resilience is. UK Healthy Risk Assessment tool also summarizes the emotional resilience as the attitude and skill set of an individual, allowing them to cope with great efficiency and effectiveness in the periods of change and stress. So this is almost similar, that in a highly pressured and changing environment, you have to perform, and perform really well. So that particular skill set that you will have is the emotional resilience that will provide you the tools with how to deal with that situation. Now, some of the quotes from some of the people who are either clinical psychologists or people who have done a lot of work in that, Wilson Thrush, emphasize qualities of mental flexibility and creativity in defining resilience. So there should be a bit of mental flexibility and thinking creatively, because you're in the high pressured and continuously changing environment. And in that, you have to perform really well. So psychological ability to let go of old internal structures of thinking and behaving that over the years have given you a sense of, or given us a sense of stability and coherence. So as I just said to you, what do we all want to look at? So you want to look at the stability, you want to have a look at a very fixed type of a very good clinic, work in the hospital, have a good salary, or patients coming up and having a good practice and earning good amount of money, and have a routine and no change in the life type of system. But then that will be something which will not make you resilient. It has to be the internal ability that you need to have, psychological ability to let go of the previous structures we have made. I'll do the job 9 to 5. I don't work after 5. Sometimes you might have to break that. You have to work after 5 as well. So these type of structures which are built up for a long time of working in a stable atmosphere, and suddenly you're challenged with something you can't change. And that's why you need to have that flexibility, but develop that flexibility to allow that stability to break a bit, and then that coherence to break a bit, and then face the challenge which is coming. And also our ability to create and reintegrate new structures of thinking. And the new structures of thinking can be in any area, personal or professional, and behaving that provide us a more mature sense of coherence. So we need to start looking at this new structure that you've made. So working not 9 to 5, but 7 to 6, I'll be working, whatever it is, in your workplace or in your personal life. If you develop that, then that will become your coherent state after some time, because you'll be settled in doing that. Now, Peterson and others in 2008 have provided the evidence of neurobiological basis of resilient behaviors in leaders. So studying after the world leaders, how they respond. They are resilient individuals who have got a strong view of reality. So they are not living in dreams. They are not daydreaming. They are having a true coherent sense of the world and the reality of the situation. They're very logical in their interpretations of setbacks. So what happens with a failure? So we talked about this just now, that in your career, in your examination, assessments, in your practice and everything, whenever there's a failure. So if you stop thinking and then say stop doing all the things that you were doing, it'll be a disaster for you. So you don't do that. Instead, what you do is you learn from that setback. You learn from that examination that the failure happened. Learn from the interview. Learn from the failure of the patient that you have somehow failed. Then you start to look at things where you want to improve, where you want to increase. So this is something which, taking the steps, very logically thinking about them and interpreting them with what happened in the setbacks. And then the also leaders will develop realistic optimism as well as the motivational processes and the strategies devised for overcoming life's obstacles. So it is in a similar way that you have got people who learn from the setbacks. You become quite motivated to learn from that failure that has happened. You become realistic, and also you take some guidance from how things have gone wrong, what you should not be repeating. So how should you develop that? I mean, how is resilience developed? So if I give this lecture today and you all are listening, 50 odd people on this call today listening, will you all develop resilience the next day, next week, next month? No, that is a process. That is a process. You can start the journey from now to develop that. So traumatic events do happen in everybody's life, but don't take the traumatic event as a negative thing in your life. The losses, the personal losses you've got, the financial losses you've got, the career losses you've got, the relationship losses you've got, don't think them as a setback, as a permanent negative thing that happened in your life, but then move on to pick up what you've learned, what you can do from that. So traumatic events will happen, they will put you in setback, but then get back to the track and learn from what went wrong and what should not be repeated in the future. There is another element that will cause the stress to all of us. So we say, oh, it's quite stressful situation, I'm stressful. But then where is the stress? So stress you're talking about, maybe the examination failure is a stress. Is the stress inside your head or outside? Just think about it. The stress is usually sitting outside, and we create an environment to come for the stress to come inside our heads and enter our heads. And that's where you have to see what is the actual stressful situation and what is my perceived stress. So this is linked to the anticipatory anxiety as well. What is that anxiety provoking situation? Tomorrow there is an interview, there is an examination, there is a career opportunity, and I'm worrying it so much that I can't prepare. I'm that in a freeze response now, or I'm in a flight response. I'm going to run away. I don't want to do that. So that you need to look at this actual stress. Yes, it is there outside, but for that I need to prepare to be well prepared in front of the interviewers or the examination or whatever the challenge is there. You need to look at the actual and the perceived stress, and you'll always find that your actual stress was less than what you were perceiving it to be. And then you do your stress management. How do you do that? Just basic examples, breathing exercises, relaxation techniques. You've got lots of those in the YouTube to search for how to do relaxation exercises, breathing techniques for stress management. And then avoid all or none phenomena. Avoid this completely black and white thinking. So if I fail the interview tomorrow, that's end of it. If I fail the examination, that's end of it. If I do not go for the job tomorrow for the first day, that's end of it. There is nothing which is end of it. It's always the gray area in between. And there is nothing black and white that clear in any field. So when you say that somebody scored 100%, are they 100% perfect? They're not. They might be 100% in mathematics, for example, but in the sciences or in other English or other languages, they might not be. So there is nothing like 100% or something. There is always the gray area, which is one of the important areas. And then when you work on that, that's how your emotional resilience will develop and create it. In doing so, while you're building your emotional resilience, what you need to actually practice in your meetings, in your discussions with people, in your friends and families and everywhere is to stay focused on the task. To stay focused on the task, but not to be rigid to an extent that you break relationships. Because in building resilience, one of the important areas you'll finding is it is very important to have relationships, your personal relationships, your professional relationships, your friendships, your family members, your relatives, your neighbors, your community. All these have an important part in building up that resilience. So you can't be completely inflexible. So you have to be flexible in that, but focus on the target and productive at all times. You should be less afraid to try new things or new experiences. And that goes with the idea just now we talked about the fear. The instilling of the fear is that you'd not try something which is new. I mean, I'm not asking you to put yourself at risk or danger, but then always don't be afraid of trying something different, a different route to get to the success, not shortcuts, but different routes and different mechanisms or methods. Managing and tolerating strong emotions outside your comfort zone. And I think this is also pivotal when you're trying to look at developing resilience among people, that you have to manage things out of your day-to-day, a very sort of comfortable life. You have to have a challenge that comes up so that you step up the challenge and try to face that difficult situation. Now, this is the important one, which I was just mentioning, strengthening your relationship. This is important many levels, but foremost important is communication skills. Who do you talk to? Do you go and talk to strangers? Who to meet with? Do you meet with strangers and discuss things? No, you discuss, talk, and communicate with your family, with your brothers, sisters, spouses, with your parents, with your children, with your family members, extended family, your relatives, your neighborhood, people who you know, your friends, your trustworthy people. You'd speak to them. So you need to have that sort of strengthened relationship to have that resilient character built in you. Bolster your self-esteem. That means you're increasing your confidence. And there are, again, different methods and mechanisms. Obviously, a lot of YouTube stuff is full of how you bolster your self-esteem and confidence. But one of the things is try to speak out to people and talk to people in a confident manner. And then by gradually doing that, you'll improve your esteem. And be confident in yourself, as you are going to find a solution to the problems which are existing. Now, in regulating, so what we have talked about now is sort of the neuroscience and how the emotions are built up and developed and how the resilience is built. But then sometimes it does happen that you have to look at and try and train yourself. And there are three aspects of training yourself in regulating your emotions, and that is cognitions, perception, and actions. And people who are into psychology and psychiatry, they will know what these things are. Cognitions are the way we think. Perceptions are the way you analyze and evaluate things. That means all five sensations you've got: the seeing, hearing, smelling, taste, the touch, gustatory, olfactory. All these are perceptions, and that's how we get the information, send it to our brains, and the cognition starts to think. And the third aspect is action, the way you react to that. So these are the fundamental three areas you have to look into when you are trying to regulate your emotions. And emotional resilience can be developed by these concepts. Just think about this. You don't have to do a rocket science of that. Our thoughts influence our actions, isn't it? So what we think, that's how we act. Except for the areas where you're doing the adrenaline reaction, where you're doing the stress reaction, which is the flight, fright, and freeze reaction, you are actually, your thoughts are being influenced, your actions are influenced by your thoughts. Acknowledging stress and willing to effectively cope with that. So sometimes it does happen that you do not want to acknowledge the stress that is there. Are you stressful? No, I'm not. You're busy morning 7 o'clock to 12 o'clock at night time, and your family recognizes your stress, your friends recognize your stress, but you do not recognize your stress. There is a problem there. So recognize your stress. That's why you address. That's how you address when you recognize. Changing flexibility while adapting to new situations. And again, developing resilience doesn't mean inflexibility. Becoming resilient means flexibility. You need to become more flexible while adapting to change situations. So you want to adapt to. So you want to go to A to B, to routes. One route is being given to you, and you're trying to follow that. But then there's another simpler route there, but you don't want to take that because, oh no, I'm not very sure how it leads to, or what will happen to, I'll get stuck somewhere. Try that out and see what happens. Accepting the truth that by changing the way we react to stress, a lot of difference can be made. So you have to tell yourself, and then self-compassion and empathy is an important part of regulating self as well. Now, I think what I will do is I'll just talk to you quickly about the concept of learned helplessness, because this is something which is an area where people know this in a way, but they don't realize until a full-blown depression or a very significant amount of low mood starts to develop. So Martin Seligman introduced the concept of learned helplessness. Now, I don't know how many of you know or have heard about the concept of learned helplessness. Now, in the chat, just put it down whether if people know what is learned helplessness. I just wanted to get an idea if people have heard about this concept before. I think obviously you can read it now, the slides, but okay, yeah. Right, okay, yeah, so some of you have heard about the experiment which was conducted, some of you have not heard about it. So Martin Seligman was someone who started this idea, this concept in the 60s, the idea where he experimented on dogs. And what he did was, there were some dogs put in a chamber where the electric current was given to them, from which the escape was not possible. So they were caged in a way that they could not escape. So that was one set of non-escape conditions. The dogs in the escape group on this could escape the shocks by pressing a panel with their noses. So as soon as the shock is given, and they are trained to press a button, a panel, and the shock will go away. So this is another group of escape dogs. In the second phase of the experiments, the animals will place in a shuttle box, which was divided by a barrier in the middle, so that the dogs could, so whenever there is a possibility, when there is a shock given, the dog could jump over in order to escape the shocks. Now, only the dogs who have learned in the previous phase to escape the shock were able to jump over the fence, jump over the bar, and go away. All the other dogs, which were in that group where they could not escape, they were not able to jump over. And that bar, so I'll just show you, this is not a big bar we're talking about. So it's a small bar where they did step up and go. So the dogs who were trained or who were put in a situation where the escape was not possible, they could not have done anything. Then they did not do anything, even if they could have easily stepped up on the other side where there were no shocks, and they would have been free to go. They could not. And the reason of highlighting and looking at this in this presentation is depression. One of the theories of depression is this: when you have got a sustained presentation of learned helplessness over a period of time, you've learned how to be helpless, basically. You've learned how not to react. You've learned how to get things in the same way, do things the same way without having any results done. You might land up in depression. Without getting good results out of your work done, you might land up in a depression, clinical depression condition. And this was one of the earliest experiments done that way to show how people do develop depression as well. But there are a lot of other theories that have come about for depression. Now, learner helplessness is a psychological condition in which a person believes that they have no control over the outcomes of their actions, even when the opportunity to help them is present. So, like the dogs were given the opportunity to run away on the non-electric side of the bar by jumping over the fence, it's a very small fence, they could not. I mean, a lot of people, I mean, all of us have gone to the zoo. I'm sure you have seen. In the zoo, if you notice, or if you haven't noticed, just notice the one of the legs of the elephants will be chained with a very small chain, a very not very big chain, and it's tied to or just kept by the small trunk of the tree, which the elephant strongly pulls over the trunk. The trunk will be uprooted, or a small stick, or an iron piece, something that it will be chained to. From the beginning, from a small age, the elephant has been tied like that. The elephant tried many times to escape the situation, but it was not able to. And that's why now, leaving the chain around in the one of the legs, the elephant will not run away because it thinks that it is changed now. It can't escape the situation. And that's why in the zoo, you'll see them with a chain, not moving at all, standing in one position for a long time. And that's a learned behavior, and that is possible in the human. So there are human experiments done as well. Repeated exposure to uncontrollable stress of failure, generalization of helplessness to other life domains, passivity, demotivation, reduced effort, not unwilling, non-motivated to do anything, often linked to depression and anxiety disorders. In humans, students giving up school, repeated academic failures, and you can take that to anything, failures in the interviews, in your career, and whatever is happening around you. Abusive survivors feeling unable to escape the harmful environments, and the consequences: decreased motivation, confidence, poor academic performances, poor problem solving, increased risk of mental disorders like PTSD and depression, and impaired learning is present. Now, just before we finish, I think it's very important to look at, and that is the idea of the compassion and the care that you have to provide in somebody you know, because this is very important for all of us. Mindfulness is a type of meditation which you focus on being intensely aware of what you're sensing and feeling in the moment without interpretation or judgment. Now, not to say that mindfulness is the only way, but one of the ways. You can easily use the Quran as one of the methods to recite and then implement that in your lives. Try to see how not be non-judgmental, how you do not interpret without any proper evidences as well. Practicing mindfulness involves breathing methods, guided imagery, and practices other practices to relax the body, and then and also helps to reduce the stress as well. And spending too much time on planning, problem solving, daydreaming, and thinking negativity will or having random thoughts can be draining for people, and that's why relaxation is an important area to consider. It also makes you more likely to experience stress, anxiety, and symptoms of depression when you are in under a stressful environment, and that's why practicing mindfulness or similar techniques can be very helpful to people. And mindfulness just describes a feeling. It's described as a method of living in the moment. You forget the past in the present. So you are in the present now. So you don't think about what happened before. Ignore the future in the present. So now, how I'm sitting in a room, there's fan sound I can hear. I'm sitting in a seat, I can feel the pressure. I put my feet on the floor, I can feel that. So all these things are you're trying to say to your mind that you're present here now. That's how you bring yourself in here. Live in the present. And this is very important for paying kind attention to people. When you are paying kind attention to people, that means that you're listening to them. You're listening to what they're saying. You're listening to what is happening to them. So you're not being, so as a psychiatrist, as a doctor, as any doctor, as a GP, general practitioner, as a consultant, neurologist, internal medicine, or anesthetist, or anybody who's there, to listen to people, what is saying, in full focus and attention in the present. And that's what mindfulness teaches you to do in practice. And this is, I think, by all means, the last slide. So in mindfulness, use the presence. You are there. You are aware in your presence. You're kind. you're not distracted by things, and you are feeling relaxed. And all these sort of undistracted, focused on things. What's happening to me now? I'm talking to you. If you're doing 10 other things and not paying full attention, you might have lost a lot of what I have said. But if you're focused, if you're not distracted, if you're clear, you're awake, you're noticing things, you're paying attention, and you're open on what being said, you're taking more and more. And that's how mindfulness works. And I think this is one of the important techniques that we should all be using. So as I said to you towards the end, I'll just check people. I've covered the neuroscience of emotions, the do's and don'ts of helping your friends who are suffering from mental health issues, and then developing emotional resilience, and then using the listening with care and compassion as or some of the yes. I mean, just I think this is the probably the last slide. Yeah, this is the last slide. So emotionally resilient people are aware of their thoughts and emotions and in their potential. They think before acting. They're patient, understanding, and willing to adapt. Are high on acceptance and forgiveness. Afu darwizar. This is something which you need to practice to become caring and compassionate, focus on finding solutions rather than pinpointing or victim blaming. Express their emotions in a socially acceptable way. Do not bottle up negative emotions, because you will become a negative vibe around with people. Are able to create and sustain long-term relationships. This is very important. Resilience does not mean to become rude and aggressive and brazen in their talk and dealings. Are not ashamed to ask for help when they are in the need for the most. Believe in a strong sorting out conflicts through discussions, and they believe in that sort of approach. They are resilient people. So this was what I had for you. As I said to you before, we would have the face-to-face session. We would have some exercises, some workshops to do, but because it was a Zoom session, I was not able to incorporate that into this. And that's what I've got. So I think it is all for the panel discussion now. I'll just stop sharing my slides in here so that it becomes an open platform now.
Thank you so much, sir, for such an enlightening and profoundly impactful session. We are truly grateful for the time, wisdom, and sincerity you have shared with us today. Your words have not only informed us but also touched our hearts. Now, we move on into one of the most engaging segments of today's program, the panel discussion and Q&A session titled Everything You Are Afraid to Ask About Mental Health. The platform is now open for your questions. I request you all to engage actively and feel free to ask your questions. You can open your mics and ask the questions, or you can post it in the chat box. You can even post it directly to me. I'll make sure to convey them to the sir on your behalf.
Assalamu alaikum wa rahmatullah. I have a question for sir.
Yeah.
First of all, thanks a lot, sir, for this amazing session. It was definitely much needed. And like you said before, other specialties do get a lot of attention compared to psychiatry. Now, coming straight to the point, sir, like you have rightly mentioned, all that we can do to help somebody who's clearly struggling with mental health problems. But sir, as we know, the problem doesn't really end with consulting a psychiatrist or a psychotherapist, because it is a journey of recovery. Like how it takes the time for a mental disorder or a disturbance to develop, it takes a longer time for the recovery too. So how do we keep the strength to face the challenges that come after the consultation? Not just for the person who is suffering from the illness, but the entire family sometimes seems to suffer, especially when there's a family member, a parent, or an elderly living in the family, and you're already busy, you're managing a lot of tasks on your own. You barely have any time to take care of your own self, and then you have somebody in your family who's unable to take care of themselves, and on top of that, they're struggling with a mental health issue. So how do we take care of ourselves, and how do we make sure that we are being there for them, sir?
Yeah. No, Salman, that was a very good question. As I mentioned, the one of the inabilities of the Zoom session is to have that sort of face-to-face workshop type type meeting. I mean, we do have the workshops as well on the Zoom, but we would have had something as a practical scenario of what you do. I think there are two elements to the question you asked. One of them is the type of approach. So I meant in terms of the helping is not to say that you go and consult, take the person to the psychiatrist or psychotherapist and psychologist and get the problem solved. That will not happen. The approach to the mental health conditions is the biopsychosocial care. So that is a comprehensive approach to the mental health. Bio is your medication approach, psycho is your psychological approach, and the social aspect, which is sometimes neglected, is one of the most important areas as well. So the medications might do something, the psychological help might do something, but a social thing. And social things are your meetings with them, your one-to-one dealings with them, you're talking to them, you're listening, you're being compassionate to your family member, your friend who is suffering from that difficult situation. You're having a tea time discussion with them, having sort of frequent meetings with them, not to be judgmental, not to be critical of them, and to be supportive of them. I think these all areas are important. So biopsychosocial care is something that is needed for someone who is suffering from a mental condition. Now, you might have also seen anxiety, depression, panic phobias, common and mild to moderate mental health conditions. But looking at the psychosis, for example, schizophrenia, bipolar affective disorder, manic presentation, personality disorders, borderline personality, histrionic personality, antisocial personality disorders, mixed personality disorders, eating disorders, dementia. These are significant, serious, severe mental health conditions. And in that, the family, I mean, as you rightly mentioned, the whole of the family becomes, they become engaged into a lot of issues and a lot of problems. And that's where you need the resilience of someone or a group of people within the family. Being the doctors, everybody will look at you. And that's where your question, how to deal with that. I think one of the take-home messages I would say to everyone from this is to try and read more and try and develop emotional resilience in yourself and teach them to your family members, to your brothers and sisters. And just go through a few things which I've mentioned in the slide. I'll try and share the slides with the with Saifuddin, and you can have that. So it is thinking the cognitive aspects, a stressful situation. How do I deal with that in a calm and composed manner without the anxiety and stress overtaking me and then overspilling from me to other members in the family, and everybody gets stressed. And you see this common phenomena. Something goes wrong with someone, there's a panic attack, everybody gets quite panicky about the situation. But then one person or one or two people should be strong enough to be able to solve that situation or hold that situation or appear to be holding that situation for some time. But then looking after your own mental health, you need to have your own social cohesion. You need to have your own social circle. That might be your own friends, having some time with them. I mean, IMSA, groups like this, you need to have some regular well-being meetings every so often. You mean 2-3 months, once in two months or so. You need to have some meetings where you can have a light-hearted way of meeting together and enjoying your time as well. Having some sportive activity as a part, exercise as a regular part. For well-being, I said the comprehensive model of psychological, medical, emotional, social. So well-being covers all aspects of the health. It is not just only sort of looking after someone from the emotional point of view. No, looking after someone from the psychological health point of view, looking after social point of view, how you're spending your time, how you're spending your time with the community, doing the activities. So I think you need to devise your ways and means to see how you can look after your mental health alongside looking after another person who is suffering from mental illnesses. And I've distinguished this between mild conditions like anxiety and depression to significant conditions like severe depression or bipolar disorder, schizophrenia, and psychotic type of conditions.
Sir, there is a question.
Yeah.
How do I keep moving and stay motivated at times when I feel extremely low and feel like I cannot do it and giving up seems the only option?
Yeah. So think about this in it is not a rhetoric, but I must say that there is always another option. So when you think there is no option but to give up, I would say that Allah subhanahu wa ta'ala has never closed your doors to come to him. And you will find this many, many times within the recitations of the Quran, when Allah subhanahu wa ta'ala has said that if you're fearful, if you're scared, then think that I am there. And in the matters of fearful situations, when you are scared of something, then I'm there. There are dua that du'as Nabi Karim sallallahu alaihi wasallam has mentioned many a times, that to ask Allah's forgiveness and ask Allah's mercy to not make you sorrowful, sad, save you from grief, save you from envy, and all these sort of evil things that happen around you, how to save you from these things. Not to say that you either make dua and not tie your camel. Always tie the camel. So always try and attempt do the things what you can do. So the similar things as I mentioned early on to the question Salman asked was about how you connect with people. So if you are someone who is quite isolated, or if you're someone who is experiencing going through low mood, and you have come to a conclusion, it looks like depression, it looks like clinical depression, you need to consult. You need to look out for some sort of mechanism by psychological assessment, by psychiatry assessment, that what is it that I'm suffering from? So being doctors, sometimes we either underestimate our own symptomatology to say that, oh, it's not that bad, or we think that, oh, it's a severe thing, serious thing, or a stigma or taboo that I can't go and ask for help. And within the main reason for asking all of you the question about how many of you will choose psychiatry was to look at the stigma. Unless we as medical fraternity fight stigma of psychiatric conditions among ourselves, how are you going to fight it with your patients and in masses, in general community and people? How will you do that? You won't be able to do it. So you need to fight the stigma with yourself to say that, yes, I need help. I need to sort out help, go out and see a psychiatrist. And also, I think my psychiatric colleagues, the psychologists who we work with, need to spend time with the patients. When you're training yourself or training your trainees, if you're senior doctors training, just take time to tell them that the psychiatric assessment will not be a 10 minutes assessment. It is very difficult to finish off a psychiatric assessment in 10 minutes. You need time to do a complete and comprehensive assessment. So you need, if you need a biopsychosocial help, medication, psychological and social help, then you go ahead and ask for that. And also, I think, use those techniques and methods that we have talked about just now, and the ahadith that we listen, and the verses in the Quran as well are quite strengthening to provide us with that robust backup we need to look at.
Thank you for your answer, sir. We have few more questions, sir. How can we keep ourselves away from medical student syndrome? Like sometimes we feel like what we are studying, we are suffering from it. The signs and symptoms of some pathology we study, we think we have those signs within ourselves. So how to overcome it?
Okay, if this is something at the level of not getting worried about, that's fine. I mean, this is quite natural to think sometimes that, oh, I've got some symptoms which look like a Crohn's disease. I've got something which is like ulcerative colitis, or something which is not very common, but we start to think about that's happening to me. I mean, that happens and goes away. That's fine. It's a curiosity, anxiety, curious anxiety, and curious mind which explodes and develops. That's absolutely fine. But it becomes to the level of somatization, that you're starting to every so often that you might be thinking that that particular condition, you have got that, and you are asking for help, and it fluctuates. It moves on. So it becomes asthma on one day, it becomes COPD of a different kind of emphysema, or it becomes pulmonary COX, it becomes Crohn's disease, it becomes some sort of cancer. Then I think it is somatization disorder, that type of presentation you might be experienced. If you are having the trouble that you are not able to concentrate in your things, your personal, social, occupational life is getting affected, then you must ask for help. There is another condition called hypochondriacal disorders, hypochondriasis, you can call it as. Yeah, okay, so Salman has mentioned here hypochondriacs. So, I mean, this is used as a misnomer sometimes. So, hypochondriacs, we call them a lot of people, but this is a particular condition in which it is amounting to a delusional level of belief. So, your belief in that particular condition. So, for example, I have contracted, I've developed a cancer of some sort. Then what the hypochondriac will do is will go out, seek and ask for help from GP. The physician says nothing is wrong with you. Don't believe that. Go to a diagnostic center, get all sort of blood investigations done, the MRI, the head scans, and the full body scan, everything comes back at normal, doesn't get satisfied, go to cancer specialist 1, cancer specialist 2, cancer specialist 3, international specialist somewhere, and that never ends. And that is a hypochondriacal disorder. And that is to the delusional level. So that means you can't argue with them. You can't logic with them. You can't reason with them. And it is out of keeping of their the educational or social norms. So I think, which I would say that I don't think that's happening with you, because otherwise you would have been asking for help many places. But that's hypochondriasis. But it might be a somatization, if it is happening with different disorders, not a particular condition, or it might be a curious mind that is asking for questions. That is very normal for some people to happen.
Thank you, sir. We have a question related to panic attacks. How to tackle with panic attacks during exam?
So panic attacks are a form of anxiety disorders in the International Classification of Mental Disorders by the WHO. So when you have one panic attack, it's a panic attack. But you've got 2, 3, 4 panic attacks in a year, it becomes a panic disorder. When you have panic attacks, it should be a full-blown panic attack. So full-blown in the sense that your breathlessness, your breath becomes quite shallow. You might have palpitations, awareness of your heartbeat. You might sweat sometimes, tremulousness and trembling of your hands. You might feel that something bad is going to happen, impending fear. You're scared of something bad is going to happen. You become dyspneic sometimes. You have a choking sensation and dizzy, and you might pass out or faint. This is the full-blown panic attack. Everybody does not get this. You get a mix of that. You might get 1 or 2, you might get 3 or 4 symptoms, and some people get a combination of 1 or 2 different kinds, different types at different occasions. If you're asking about that particular panic attack, so you need some biological and some psychological help. The psychological help at the first time, relaxation techniques, breathing exercises, that's something to follow. And again, as I said to you earlier, there are lots of videos to how to do breathing exercises. Try and make a routine, and that is very helpful. Initially, it looks difficult, but it becomes easier to practice after some time. Medication help is there. There are a number of antidepressants, anti-anxiety agents, SSRIs, and other group of medications which are helpful. And then that has to be taken in consultation with your psychiatrist. And I think that assessment will be needed if it is panic attack. Something linked to the examination, I would say, if it is not a full-blown panic attack, maybe just deal with the breathing exercise and relaxation technique. You might not need medications or any biological help, but maybe just try and do some breathing exercises before the exams, around exams. I think continue doing that. You will feel better. If it's not helping, then probably you might ask for a professional help on that.
Thank you for your answer, sir. And next question is, how can I manage anxiety, performance anxiety during exam preparation and anxiety-induced dizziness?
Yeah, so as I said, anticipatory anxiety, that is how you're going to perform in the exam. It's very common. Developing the, I don't know whether you have tried before, relaxation techniques or breathing exercises. Try and do that. If you're not able to do that and you've done it on a few occasions, it's not succeeding, then you might need medication. But one of the things to say is the relaxation techniques and breathing exercises do not work when you're having a panic attack. And I think that is slightly a misconception people have, that when they are in a mix of a panic attack, they start to sort of do the breathing exercise. Breathing exercise will not work at that time, because you are in a state of a panic attack. breathing exercises you need to develop over a period of time. So you need to start working on them how to do the breathing exercises morning and evening every day. Practice it every day over a period of weeks and months. Then you're training your mind how to be relaxed in a tense situation. And that's how the breathing exercises will work. But then if you're looking at doing at the time of panic attack, it will be very difficult. If you're having a full-blown panic attack, the basic idea to breathe and rebreathe in a mask will be something which is you can do in a cover in a paper cover. You can try and paper bag. You can do the breathing in and out. It will remove the physical symptoms of anxiety quite quickly, but there's still the psychological symptoms might remain, for which the breathing and the relaxation might help. But if it's not working, then probably you might get some professional help around that time. These medications, which are used mostly in the panic attacks, are the antidepressant medications. Most of them are SSRIs. You do not get hooked onto them. It's again misconception that people get hooked onto them. Some of the people who have to take it for a very long time is because the anxiety is quite significant. They have to use it for a long time. But at the same time, many people who suffer from anxiety and depression come out of these medication as well without significant problems.
Thank you for the answers, sir. We are done with the questions.
So I have one last question.
Okay.
Uh, um, Thanks a lot for all the tips. Just I'd like to just point one thing, sir. You mentioned that when we already have somebody struggling with mental health issues in our family and we are unable to take care of ourselves, it sometimes helps to go out with friends or share our feelings with them. But what if there is nobody else who you can talk to? Uh, Sometimes what happens is, in general, if at all somebody has an illness or a disease, you see them. Let's say somebody has arthritis or something. So you have seen that person walk freely before. Then you know that they have some disease. It is apparent to your eyes. It is very obvious. You see them. You take them to the doctors. You see them walking again, so you feel happy. So the improvement happens in front of your eyes. So you have regained the person back. But when it comes to mental health disorders, it is often silent. The symptoms are silent. They do not manifest in physical form. Like there are no physical signs which a layman or a person can recognize directly.
Yeah.
And over time, the person who you knew 3 or 4 months back is no more. You don't see them smiling at you. You don't see them talking to you freely like they used to do before. You don't sit together or talk like you used to do before. So, how to
Yeah.
deal with that emotion of losing somebody's personality or losing a loved one to a psychological illness, and
Yeah.
knowing that they may not come again, like that personality, they may not regain
Yeah.
that personality ever again, and sometimes they'll have to be on lifelong medication.
Yeah.
So, how do we build a resilience? How do we move on knowing that that person may not come again?
Yeah. No, I think that this is a very important question, and I must say that it would need a lot of probably counseling. You might need some professional help in that to address that. But I think some of the tips that can be done is again try and support as much as in your remit to help that particular individual to be available for them as much as they need. Sometimes the condition is such that people don't want anybody close to them over a period of time, and then during that time the relationships are soured or distanced, and then everybody has started to have a new network, and then when person 2 3 years after tries to reconnect, everything has changed a lot. If you are a true friend or if you're a true person who supports or cares for that individual, you should be available for them as long as it takes. So that was in one of my slides. Did mention that as long as it takes. So it takes some months, it takes some years. Sometimes psychiatric conditions are very different to the physical health condition. You give example of arthritis. Yes, there is no one method of investigation is to put them somebody to a PET scan or a SPECT scan, MRI head scan, and you come out a schizophrenia or a depression. It doesn't happen in that way. It is mostly clinical, it's mostly that clinical acumen in a very good experienced psychiatrist. But then also it's very common in someone who has dealt with a person with mental illness. You will be able to pick up the signs very easily if you've seen and dealt with and talked to people who have gone through this, and especially people who've got some family members, a close friend. You will know if your friend is suffering from that condition, and you can help and support them in that way. So it is very difficult, I think. And I think if you dig deep down, it is the stigma again. So that question again, going back to my question, the stigma is quite big about the mental illness. Arthritis, that person might be going to an orthopedic surgeon or a general physician asking for the treatment. They will never be shy to tell you what the treatment they're taking. If they've undergone a surgery, they'll tell you that they've undergone surgery for arthritis. You will not never find that somebody said that I've been admitted to a mental hospital or I've been admitted to a psychiatric unit. I'm taking psychiatric medications. I'm on antidepressant medication. Nobody wants to say that, and that's a stigma. Unless we start to create awareness among our friends, colleagues, communities. And I might not be giving you the direct answer personally to your circumstances, Salman, but it is a thing about the community. I think unless this comes out from the member of the masjid, unless it comes out from the community centers, from the local mosques, the imams, and people talk about the mental illnesses as commonly as you discuss about the specific issues of deen. And I think unless that a situation will not change and people will still suffer, you will have this stigma going on. I think the community, the massages should have the well-being centers. The massages should introduce the idea of talk to people freely, the mental health conditions, to seek advice and guidance from the psychology, psychiatrists, take times for people to come to the central masjids, I think the city center masjids, where you can have that sort of easy talk with people, and the stigma will go away in that way. It won't be going away just in a short period of time, because this is really really quite entrenched in all of us. So it is a difficult question. It is a difficult situation, I think. But I think you might need some personal one-to-one counseling from a good psychologist to talk to you about the resilience building, about the cognitive behavior therapies, and those type of behavioral modifications that has to be done to try and support the people with mental conditions.
Thank you for the answer, sir. We have one more question. Can you please list some books on psychology in regards to mental health of doctors, or Islamic books to deal with fear of failure or fear of lagging behind?
I think fear of failures. I would say that, I mean, not coming to my mind the particular book, but the concepts of learned helplessness by Martin Seligman. If you have a look at how the failures are to be looked on, and to move on, will be quite helpful. And also, I think Wilson and Furch, who have done this piece of work in 2005, that will be important to look at. The cognition, that the way we act and the way we behave will be very important. So what we think, and that's how we behave, and then we do the actions. So our emotions, our behavior will be guided by how we're thinking and then how we act. I think that will give you some idea of to build up the emotional resilience among us.
Thank you so much for your answers, sir. I hope we are good to conclude with the session. Alhamdulillah, Alhamdulillah, as we come to the end of today's session, we would like to express our heartfelt gratitude to our distinguished speaker, Professor Farooq Khan sir, for his time, wisdom, and invaluable insights into the often silent battles faced by medical professionals. Your words have not only educated us, but also inspired us to approach mental health with empathy, awareness, and courage. We also thank everyone who have joined, listened, and engaged with sincerity. Your presence and attention made this gathering meaningful. A special note of appreciation to IMSA for organizing this much needed session and contributing to foster spaces for growth, support, and holistic development. May we take today's reflections forward, not only in our medical practice, but in how we treat ourselves and others with compassion and care. سبحانك اللهم وبحمدك نشهد أن لا إله إلا أنت نستغفرك ونتوب إليك. جزاكم الله خيرا كثيرا. السلام عليكم ورحمة الله وبركاته.